Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. An important study was published in the Journal of Nutrition in November of 2020. In agreement with previous studies of this nature, the researchers showed that a mother's vitamin D blood level during the second trimester of pregnancy has a significant impact on her child's IQ measured at ages 4 to 6 years old. Now, this should not be a surprise, as the mammalian brain has vitamin D receptors by the 12th day after conception, and the developing fetal brain requires vitamin D for many aspects of brain development to occur. As the researcher stated, maternal vitamin D is transported through the placenta, and by binding to vitamin D receptors in the fetal brain, it exerts transcriptional control over many genes related to structural brain development. The fetal brain needs adequate vitamin D for normal development. So this study used data from the famous CANDLE study. CANDLE stands for Conditions Affecting Neurocognitive Development and Learning in Early Childhood, which included assessing the maternal blood of over 1,500 pregnant women in their second trimester of pregnancy, whereby only a single fetus was present. In other words, where ultrasound showed there were twins or triplets, they were excluded. When there's just going to be a single birth, they just followed those women and those children. The study clearly showed that the higher the maternal blood level of vitamin D in the second trimester of pregnancy, the higher was the child's IQ, as well as verbal and nonverbal IQ at ages 4 to 6 years of age. Now, alarmingly, the study showed that 46% of pregnant women in the United States who participated in the study had deficient levels of vitamin D in their blood. 46% had deficiencies. This was a US-based study. Vitamin D deficiency is indicated by a blood level of vitamin D that's below 20 nanograms per milliliter, as this value has been established to help ensure adequate bone health. However, this level of vitamin D at 29 nanograms per milliliter may not necessarily be high enough to ensure optimal fetal brain development, or to help to prevent the development of cancer, diabetes, Alzheimer's disease, or to ward off other diseases that may be impacted by suboptimal vitamin D levels, according to emerging studies. Now, Black American women appear to be most prone to vitamin D deficiency, as their average blood vitamin D level in this study was only 19.8. The average was under 20. Caucasian women had an average vitamin D level of 25.9 nanograms per milliliter. According to lead researcher Melissa Melu, as many as 80% of Black pregnant women in the United States may be deficient in vitamin D. In fact, according to the researchers, vitamin D deficiency is a worldwide problem affecting the general public and women of childbearing age, especially among those with darker skin. And this is because darker-skinned individuals have more melanin pigment in their skin, which acts as a barrier to ultraviolet light, decreasing the ability of ultraviolet light to penetrate the skin and turn on vitamin D synthesis within skin cells, which later gets released into the bloodstream. So a US-based, the data from the United States from 2001 to 2006 indicated that 13% of white pregnant women in the United States were deficient in vitamin D, compared with 80% of pregnant Black women. So in this study, race was not a factor. Regardless of skin color, the higher the mother's blood vitamin D level during the second trimester of pregnancy, the higher was the child's IQ at ages 4 to 6 years of age. Now, more specifically, every 10 nanograms per milliliter increase in maternal blood vitamin D levels was associated with a 1.17 point higher full-scale IQ in the child, as well as a 1.17 point higher verbal IQ and a 1.03 point higher nonverbal IQ. In other words, as vitamin D levels went up, IQ went up. The researchers point out that the observed effect of a 1.17 point IQ score escalation for every 10 nanograms per milliliter increase in maternal vitamin D blood level translates into other meaningful positive outcomes. In other words, it's been estimated for each IQ point decrement or decrease, Males experience a 1.93% decrease in lifetime earnings, about 2% decrease in lifetime earnings with an IQ that's just 1 point lower. And females experience over 3% decrease in lifetime earnings with just that 1% or that 1 point decrease or decrement. So observational studies have also linked low perinatal and prenatal vitamin D maternal blood levels with developmental disorders including schizophrenia and autism. So the researchers conclude that the recommended vitamin D intake level during pregnancy is likely too low. They state, popular prenatal supplements, which typically contain 400 to 600 IUs of vitamin D, are likely insufficient to correct vitamin D deficiencies, which are very common across the population. Randomized control studies have suggested that daily supplementation of 800 to 1,000 IUs may be needed for repletion in pregnancy, and that doses as high as 4,000 IUs per day may be ideal in cases of severe deficiency. Importantly, there is currently no established consensus regarding optimal vitamin D concentrations during pregnancy, which means that there really isn't a stated blood vitamin D level that doctors are looking for. And additional research in diverse populations is needed to develop guidelines for this, which may need to be population specific for treating deficiency during pregnancy. So in the meantime, I think it's important for all women who are pregnant or who are planning to become pregnant to know what their blood vitamin D level is. From an overall health perspective, the evidence suggests very strongly that a blood vitamin D level between 30 and 50 nanograms per milliliter is a good target to aim for. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.